I would want clinicians to just give an opportunity to at least talk to Gift of Life, because they're there to help you in those desperate times make very, very difficult decisions, but that those decisions could end up having a profound impact on the legacy of your loved one and the legacy of your family.
We are the organ and tissue organization for the state of Michigan, and our mission is to honor lives through donation.
Donation in and of itself, it's an unknown process. There's some different things that people really don't know about, and our ultimate goal is to educate them on the process.
It's important to call them early because they have a chance to go through the patient's chart. Right? They can look at what are the organs at risk that you're at for losing, what are the numbers that need to be corrected, what are the interventions that can be done, and they can help guide you in maintaining an adequate organ viability before the whole donation process takes place.
We always tell people to call with any type of brain death testing, withdrawal of life-sustaining therapy if the family wants to withdraw care, or with any type of questions.
We have a very small window in terms of having that donation conversation. And as that window closes, we're going to have less of a chance to be able to save a life today.
Patients, they need support. They need a support system, a social support system, and I think a lot of clinicians are unable to provide that, and that's where a Gift of Life, they come in and they can give direction and they can give support that a lot of hospitals and clinicians may not be able to provide to the patient.
Studies show that when there's early interactions with families, that they're going to be more than likely to donate because they've gotten to know us, we've gotten to know them, and we're building this honest, caring relationship with these families. They're taking themselves out of this very intense grief and looking down the road and understanding that their loved one is living on in someone else. It helps them understand that this all didn't happen for nothing.
To us, it felt like if we couldn't donate or at least have the option or the possibility to be involved with something like that, that there was very little hope for that entire situation. The experience of that pregnancy and Hallie's extremely short life.
Our Gift of Life coordinators were just there to answer any question. They just were this calm and peace in the room. After the organs were recovered, bringing her back to us and holding her wrapped in a beautiful blanket that a donor family had made. And it was like it was her child. Like she just cared and loved, and you could tell, even though she was already gone.
And it's really tough because when we're meeting these families, they are absolutely at the end of their rope. And I will support them and let them know that regardless of what their decision is, they're making the best decision for themselves at that moment.
Physicians and clinicians know what organ donation can do, so give that opportunity to people. Parents who have no idea or who are in the middle of a shock of their lives with, something tragic happening. Give them the opportunity to choose for themselves. The outcome can be so much more beautiful, and it doesn't seem like with a death that would ever be a possibility, but it is.
Gift of Life, Michigan, they give us an opportunity to extend our hands beyond the hospital and the patient's bed to making a difference in others' lives.